guys, so what I want to talk about in today's video is my experience at a chronic pain clinic or a pain clinic. And even with my cerebral palsy, I've never been to one of these before, so it was a new experience for me. And just as a note, this was in the UK, so it was under the NHS, so it's based around that, so it may differ from country to country, but this was my experience at going to a pain clinic run by the NHS. Basically, the background to this is that I've had like ongoing knee pain for the last 2-3 years, I think now. I mean, I previously had similar sort of knee pain, but I had a knee arthroscopy to hoover out some of the gunk and get the swelling down when I was 13 years old, I think. Yeah, 13, year 9, yeah. Anyway, but in recent years that I get in similar pain again in my knee. That meant that I found it really hard to walk. Sometimes I just constantly fall over because it just gives way. And then it just hurts over any touching, any pressure on my knee. I went to see several consultants about it. Surgery is an option, but apparently there's only one guy in the country that can do it. So until I can get on that guy's waiting list, I've got to look at pain management options. And one of those options was attending a chronic pain clinic, and the other was for spinal simulation, which is slightly more involved, which I'll talk about in another video later on. But basically, so my appointment that I had, it was my very first appointment, so it was the assessment appointment. It took about an hour and a half, maybe nearly 2 hours. They were running a bit late, but not really that late compared to some hospital visits I've been on. But basically, it involved talking to 3 people. One who was a consultant anesthesiologist, so she is the expert in pain. Another was a senior physiotherapist, and a third was a pain psychologist, which sort of brought up some bad memories for me, but I'll go into that a bit later. So after discussing the background, the options you're trying out, why I've been referred here, and having a look at my knee and touching it, they gave me a diagnosis of why do I always forget the first letter? There we go. It is complex reginal pain syndrome. And even though the name sounds complicated, if you think about each individual word, it is generally as it says. So complex is in the pain is caused by something complex. Regional, it's specified to one region. In this case, it's my knee. Pain, it's pain. And syndrome is just, it lasts more of a longer period of time rather than just a day. And what they did basically is they first had a look at my knee and could see that it had gone bright purple. It was slightly more purple than I'd seen it lately, but it had been that colour several times before. And in a way, I'm kind of glad it was, because it sort of made my point that I wasn't making this up. Because you get to a point where your pain levels are so much that you go, what's the point if pain is just going to be like this all the time? So after having a look at it, the physiotherapist began to touch it just with light touching, and even that seemed to hurt, and it sort of felt like burning, throbbing, stabbing, that sort of thing, and it changing temperature. So what complex regional pain syndrome, as it was explained to me, was that the brain is oversending the pain signals to my knee. And that makes sense because my kneecap is in the wrong place. My patellar tendon is 30 millimeters too long based on the position of my kneecap. And basically my brain is overfiring the pain signals to tell you, hey, there's something wrong here. And basically what's happened is my nerves have got confused in my knee, so any sort of touch, any sort of pain, any sort of something like that seems more, and the reason it changes colour is because the brain and the central nervous system is sending all the signals to this muscle to say we need all this, we need more blood to this thing to fix it, even though technically there is something wrong with it. It's just may not be as bad as my brain thinks it is. And yeah, it was kind of nice to get sort of a diagnosis in a way. I mean, I knew there was something wrong. I knew I wasn't making it up, and I knew it wasn't in my head. But even so, there's a comforting feeling towards that. So after them having a look, coming up with that solution, though they seem to have decided that slightly before they'd done any proper looking, but they are the experts, so they do know what they're talking about. We went on to talk about treatments and things that I could try. She gave me a sheet, if I just grab it here. Let's see. That has a recommendation for a type of drug, and I cannot say the word, so it's either gabapentin or pregabalin, and also to uptake my impact in vitamin C, and that will probably help with the amount of bruising I've got on my leg as well. And the next thing that she gave me, which I've only just started trying today, was something called DSMO cream. And I don't know if I've got the bit of paper with that on anymore. No, it doesn't seem I have it nearby. Basically, it's not a licensed medicine in terms of it's not licensed for this sort of treatment, but I read that also there is no licensed medicine for complex regional pain syndrome, or CRPS, but it's made from residue of paper and wood, and basically they use it in treatment of osteoarthritis as well. And what I think it does is helps retrain the brain with the nerves. And as part of that, I've also got some more sort of physio. And when I first heard physio, because I've done physio all of my life because of the cerebral palsy, I thought exercising, I do all the muscle strength for my knee, it's not going to help, but it's actually very different. So the things they were discussing about desensitization, so touching a good leg or a good-ish leg in terms of my own normal, and then trying to associate that so your brain retrains a nerve. They also talk about mirror therapy and graded motor imagery as sort of treatment, and it's stuff I'd not heard of before, but I did some reading up on it after, and it looks interesting, so I'm willing to give it a try. So once that discussion was under the way, I went to talk to a pain psychologist, and this was to talk more about my mental health and how pain affects my mental health. I was able to tell her about my previous episodes, what I do for CBT techniques that I do now to manage my own depression, anxiety, social anxiety. And then we also we worked out that I too tend to overwork myself. I do tend to overwork and overdo it, and if there is pain, I ignore it, and apparently I've got to learn not to ignore it, but to deal with it and say, I've got pain, I've got to do this for it to make it better, rather than just ignore it, carry on, and then crash, because I've really overdone it. So it was definitely an interesting appointment, and I know I was slightly disappointed that it wasn't going to be anything immediate. It is still progress, and any progress to me is better than just leaving me in limbo, because that just leaves me in a little bit of despair if you're going to leave me in limbo. Yeah, so I thought I'd describe my experience at my assessment for the chronic pain clinic to see if to help others, or if, and I know when I got the appointment through, I did do some research about what would happen, and most of them were sort of American-based videos rather than those based in the UK, so I'm hoping that this information might be useful who's also going to attend their first time at a chronic pain clinic, as well as it's not something to worry about. These people are pain specialists. They do know what they're talking about. So I will let you know as I get on, and I will probably do a video on the graded motor imagery, and maybe even the mirror therapy and how I get on with that in physiotherapy, because it does sound interesting, and from my point of view I'm up for trying anything as long as it doesn't do me any more harm than good. So in a way it's good to have another diagnosis to say it is my brain oversending pain signals and I need to work around that. And in a way, before I got this appointment with the pain clinic, it was also suggested that I have a look and get referred to a spinal simulation, which does something I think very similar but is more involved because it's surgery, and that blocks the pain signals going to and from the brain. So because we know there's something wrong, it sends electrical impulses. But the lady, well, the consultant at the pain clinic said that is quite a major sort of operation, and it leaves you something permanent. So trying some of these techniques, even if I am going to have the surgery to fix my knee, will also help, because even if I do have the surgery, I still might have the complex regional pain after. So all this will help. So in a way, that's really positive. Thanks for watching my video. If you want to hear anything more about my experiences, let me know in the comments below, or if you want to hear a particular video about something, also please let me know about that. I have a scheduled sim video coming out, hopefully around the same time as this video, if this video uploads, and I'm also going to be doing some more video ideas, and I might show you some of the Killstar stuff I bought recently, because I've been feeling a little bit, tiny bit pretty sometimes. So yeah, thanks for watching. I'll see you in my next video. Apologies for my hair in this. We're at like heat wave temperatures today, and any heat just goes